doctor is in here on this Thursday morning. Holiday season in full effect, and yeah, you know what that means. It's also sick season. The U.S. Centers for Disease Control and Prevention says a new coronavirus subvariant is now the fastest growing strain of the virus. In addition to the upward trend of influenza cases, it's all kind of combined. Joining us live, Chief Impact Officer at Sharp Resealy, Dr. Abby Olulade, giving us some more insight how we can stay safe this holiday season. Happy holidays to you.
Happy holidays, Eric. It's good to see you.
Always appreciate you coming in, keeping us healthy here. Okay, so tell us what's floating around out there. There's a lot of things happening, right?
Yes, everything. Everything is going up. We're seeing an increase in cases of COVID, flu, RSV. All of these viruses are circulating. In terms of hospitalizations, we're stable, although we are trending upwards from November, of course, as a result of people traveling for Thanksgiving and gathering. What is concerning and what the CDC is predicting is that there's going to be a spike after December, and that's what we typically see, that hospitalizations go way up in January and February. So we all want to be prepared for that.
Okay, talk about this COVID subvariant. How is it different? How concerning is it at this point?
So it is way more transmissible, obviously, because it has what we call a growth advantage. It's gotten to many people, their cases have gone up in a short period of time. We've detected it here in San Diego as well. And when we see that, it means that more people may get infected. It will not cause more severe cases based on what we're seeing and based on what the WHO and CDC is reporting. And we would expect that the vaccines will be protective. It will be picked up on testing. That was a question that someone just asked backstage, actually. We'll still see it on those tests. They will work to detect it. But it's important that we realize that, of course, it's a matter of when, not if, that we're going to be exposed to this virus, because it's so transmissible at this point. So we do want to be prepared for that too.
Okay, so going out there and getting the shot will help with that.
Yes.
Also with the flu too, are you recommending?
Yes, absolutely. So unfortunately, we're not seeing that a lot of people have gotten their vaccines, even people that are at highest risk. So people in that 65 and older age range, only about 30% of people have gotten their shots.
Is that lower from past years?
Yeah, it is. It is, very unfortunately. A lot of people don't realize that if you haven't had your shots this year for COVID, you're not up to date. And I'm very surprised to hear that a lot of patients haven't gotten their vaccine. So it's important that we protect ourselves from that. The shots actually help to keep you out of the ER and urgent cares. And that's actually a new study that came out, that it does help to reduce symptoms and deaths and hospitalizations, obviously. So we do need to protect ourselves from this.
Someone's at home, they're sick right now. What can they be doing to kind of help with the symptoms?
So I would say that the most important thing to remember is the 3 T's, right? So test, make sure that you are prepared. Get one of those tests that are actually free, so that if you have symptoms, you test and then you know if you have COVID. That helps us even when you set up an appointment with us. If we know you have COVID, then we can treat you. So that's the second T. Seek out treatment, because most likely you qualify for an antiviral, which can help to reduce the duration of symptoms. And then take precautions to protect yourselves by masking, and also make sure that you get the vaccines when you're better. Update your shots when you're better.
Awesome. Where can people learn more if they have any other questions, Dr. Abby?
So sharp.com is where you can learn more, and we have a lot of virtual urgent care appointments, super easy, same-day appointments, and we can treat you if you have any of these symptoms.
I know you're the doctor, but I give my advice to my kids, which is wash your hands every time they walk into the door.
Yes,
that helps.
that's also important.
It goes a long way.
It definitely helps. It does go a long way.
Some good reminders. Thank you for keeping us safe and healthy here, Dr. Abby, as always.
Good to see you.
Stay with us, everyone. We're taking a quick break. We'll be right back with your top headlines, your updated forecast, because that rain's on the way. Keep it here.